Hello, Dr. Bouvier with Dr. New. I'm here with a patient of mine. He's given us the okay to have this conversation, but you've come to this video to learn a little bit more about how the adrenal gland functions, or actually in this case doesn't function, with chronic illness. So basically, Fred's adrenal glands have failed because he's received so much exogenous steroid. But so we have to supplement that, and we know that when he's in a euvolemic state, meaning he's hydrated but not too hydrated, but not dehydrated either, and he still has a blood pressure systolic drop of 10 or a heart rate raise of 10, then we know that he's dehydrated, or has adrenal insufficiency. And we've tracked him, and he needs about 15 milligrams of prednisone as a maintenance, and about 0.1 milligrams of Florinef to help him maintain dizziness when he's walking. He still gets a little dizzy when he stands, but you got to wait a minute and then he takes off. But his blood pressures will go down in the 60s and 70s if systolic if we don't support him with the steroid, both the prednisone and the Florinef. So with him, everybody is different, and he has neuroendocrine, cardiac, vascular, pulmonary, other gastrointestinal issues that we have to deal with, and this adrenal failure. So don't be afraid to do testing on people, and the best test that I can tell you to do is a lying and standing blood pressure. If you, in a euvolemic state, if you get a blood pressure drop of 10 or a heart rate raise of 10, then you pretty much know that they are adrenal insufficient, even if the ACTH or cortisol even shows normal. But I always do get a morning ACTH and cortisol and a 4 p.m. ACTH and cortisol to kind of help document that. And sometimes I'll do a 24-hour urine adrenal check as well. So don't be afraid to check those things, but a bedside check, especially preoperatively and postoperatively, if you're seeing those people postoperatively and their blood pressure's crashing and they're having issues, then the adrenal gland is probably one of those culprits. So just kind of watch out for that. Test everybody who's had steroids for a while, both either inhalation or by mouth, and constantly check them for this adrenal insufficiency issue. And everybody's different. You can use Medrol, hydrocortisone, prednisone. Right now I use prednisone. It seems to work the best for Fred, and that's kind of where we're at with that. So if you have any questions about that, of course you can always get a hold of me on my cell number or get a hold of me on my email address. If you need any more videos in response to things like this, then let me know, and we'll definitely find a patient to pass that knowledge on. Again, this is Dr. Robert Bouvier with Dr. New, passing on a little bit more about adrenal insufficiency.